differential diagnosis. I try to identify a symptom or a physical finding or a laboratory abnormality within the case that I can then generate a differential diagnosis around it. The earlier you do this, the better. Why? Because now the questions you ask the patient, the physical findings you look for, the tests you send off are all hypothesis driven. And that's critical in medicine. You can now reference the differential diagnosis that you've created, which is a collection of hypotheses. And now these hypotheses tell you, this is the information that I need to acquire from this case in order to rule in or rule out that hypothesis. So the way I do this in real life is I may visit a patient, interview them, examine them, and I go back to my desk and I create my differential diagnosis. And then that gives me the hypotheses that I need. So for example, let's say I'm seeing a patient with dyspnea and heart failure is in the differential, and I see that. And if I hadn't done it already, I would know I need to go ask that patient about weight gain, orthopnea, paroxysmal nocturnal dyspnea. I need to look on exam specifically at the JVP or the jugular venous pressure. I need to listen for that S3 gallop. And that's the way it works in real life. And by the way, the history and the exam are all you need to make most diagnoses, and they're free. The history and the exam are absolutely free. You don't want to be the type of doctor that orders every lab test you can imagine on every patient. For example, in that patient number 3, are we going to order thiamine levels on every patient that we ever evaluate? No, we're definitely not going to do that. We ordered it in that case because we had a hypothesis that he could have thiamine deficiency, and indeed the test proved our hypothesis correct. So if you order a bunch of labs and tests and imaging studies on every patient you see, you're going to do them a big disservice. It comes at a high cost, both literally because these tests cost money, and figuratively because once you start testing patients unnecessarily, testing begets more testing and sometimes begets procedures. For example, you order that CAT scan unnecessarily on a patient and you're going to find maybe a spot in the liver that was otherwise benign and doing nothing, no harm to the patient. And now the patient undergoes a liver biopsy and it could, incur a complication from that biopsy. And now he or she is fighting for their life in the ICU. So it comes at a high cost here. You want to be part of diagnostic reasoning is to be judicious, be a steward when it comes to ordering lab tests. So you only order the tests that you need to order. So let's talk about the differential diagnosis, which should be more than just a list. The differential diagnosis should be organized in some way. And the non-medical example I like to give is, imagine if I asked you to name all the states in the United States of America as quickly as you could randomly. Well, you'd get going for a while, and eventually you become disorganized and slow down and come to a stop. If instead of doing it randomly, you had a method behind it. So let's say you said, okay, I'm going to do this alphabetically. I'm going to start with the states that start with letter A, then move to B, then C, then D, and so forth. Or you did it geographically and you said, okay, I'm going to start in the Northwest, then I'm going to move to the Southwest, then Northeast, then Southeast. You'd be a lot better off. And the same is true in medicine. We're asked as internal medicine doctors to memorize long differential diagnoses for so many problems. There are 50 things that cause dyspnea, 50 things that cause chest pain, 50 things that cause anemia. There's a long list of systemic vasculitides. And I would encourage you not to make a linear list here, but you should organize this list in some way. It'll help you. So don't do this. You should organize that list, and an organized differential diagnosis is exactly what a framework is. That is all a framework is. It's an organized differential diagnosis. And here's the differential or the framework for systemic vasculitis, organized by size of blood vessel involved. We have large vessel, medium vessel, small vessel. If I have this in my mind, it's much easier for me to recall this list. And it's much easier to approach a patient with systemic vasculitis if I have this framework in mind.